Thank you, Governor. Good afternoon, everyone. Thank you for joining us. As you can see, with how great a job the Governor did outlining the updates, this continues to be the place to be to get the latest information that we want to continue to provide for you. In terms of the data, as the Governor said, we are trending in the right direction. We have 51 new cases to announce today. This number is relatively low, and our numbers from over the weekend were also relatively low. 97 new positive cases were confirmed on Saturday, and 65 new positive cases were confirmed on Sunday. There are currently 146 people with COVID-19 in the hospital. Of these 146 people, 28 are in the intensive care unit, and 20 are on a ventilator across Rhode Island. Again, the trends in this area are good news. Since our last data update on Friday, we sadly saw an increase of 27 COVID-19 associated fatalities in total. There were 10 new COVID-19 associated fatalities confirmed today, and the numbers for Saturday and Sunday, respectively, were 10 and 7. Generally, the age distribution for these people was consistent with what we have seen throughout the crisis. Of the 27 people that we've sadly lost, 2 people were in their 60s, 7 people were in their 70s, 9 people were in their 80s, 8 people were in their 90s, and 1 person was older than 100 years old. Our sympathies and our prayers are certainly with the families of these Rhode Islanders. The Governor also did an excellent job outlining our overall comprehensive testing strategy for Rhode Island that fits into our scheme of testing: 1, all symptomatic people; 2, doing rapid outbreak response testing quickly and effectively; and 3, as was shared today, having a targeted, effective early warning detection system, which includes testing certain people who are asymptomatic. When we've talked about testing in the past, we have said consistently that results are more accurate for people with symptoms. That is still true. That has not changed. However, testing people without symptoms can have benefits along the lines of what the Governor shared when used in targeted ways, as we are doing here, within a larger strategy. We're sampling specific members of the population so that we can better understand the spread of illness and determine how to most effectively inform our symptomatics testing and rapid outbreak response testing. All of this supports our approach of testing smarter as we go forward. The best example of what we have done thus far with our early warning detection system is testing asymptomatic people who live in congregate care settings. That's been the first example. What the Governor shared today is now expanding to testing within child care workers, people who work in gyms and fitness centers, workers from personal service fields, and being able to really understand the landscape among those workers who are high contact workers. We recognize that this is just a sampling of the different types of workers throughout the state, and that's really what we want to start with so that we can understand the spread of disease among this population. We envision making additional announcements in the future about the people in the fields that we are focusing on. As mentioned, there will be no charge associated with testing, and people will be tested regardless of their immigration status and regardless of whether they have health insurance. As stated, you can either go to portal.ri.gov, or you can navigate there from our RIDO COVID webpage at health.ri.gov/COVID. And of course, particularly for those that may not have internet access, You can call 401-222-8022 as an option if people need it, also available in multiple languages. Once on the portal, or you call, you will get asked for some basic information, and you will be able to schedule a test at our current testing sites, Rhode Island College or at CCRI. Over time, we'll continue to ensure that we can reach the people that we are focusing on for this specific early warning detection system of testing. You will also get instructions on how you and your healthcare provider can get electronic access to your results, usually in about 3 to 5 days. So we will continue to keep you informed as we learn of the information. Again, this is a sampling of the workers who are engaged in high contact engagement so that we can help ensure an understanding of the spread of illness here in Rhode Island. The governor also referenced another example that we are incorporating into this. People who may be at higher risk because they attended one of the demonstrations that has happened over the last several days. We are recommending testing for people who have gone to a large demonstration over the last few days. This aligns with what Dr. Redfield, who runs the Center for Disease Control and Prevention, has also recommended. People who went to a demonstration can schedule a test in the same way that was described earlier by going to the scheduling portal at portal.ri.gov. And we also want people who attended one of the events to make sure that you continue to monitor for symptoms carefully. So whether or not you have symptoms, the testing is available, but particularly if any question of symptoms develop, please make sure that you access the opportunity to get tested. And then also, as mentioned, please continue to be thoughtful about who you contact, particularly if there is someone who is at higher risk over the next 2 weeks. Try to minimize contact with people in your life, such as older adults and people with underlying medical conditions that fulfill the category of being at higher risk. At the very least, you should think about avoiding embraces like handshakes and hugs with those particular people, and avoid sharing food or drinks with anyone. These are ways to continue to support each other as voices are being raised. I also want to thank all the people who came out to make their voices heard peacefully, and want to thank all the public safety professionals who did an amazing job supporting as well. We had Rhode Island Department of Health staff at all 3 events on Friday and Saturday, providing resources and support, including distributing 5,000 masks, hand sanitizers, and information about testing. We're thankful to all of the partners who joined with us to help support as well. It also gave the opportunity to stand in solidarity because, as we have mentioned, health equity is a principal focus for the governor's entire administration, as well as at the Rhode Island Department of Health. We say often that everyone should have an equal opportunity to be healthy, and that's not just talking about the absence of disease. It's also talking about the presence of physical and social well-being, and well-being at the community level. Structural racism, for example, is a public health issue because it affects health outcomes at the individual level and at the community level. When structural racism manifests as police violence, as it did in Minnesota, or it manifests as inequities in housing or education or environmental exposures, or challenges with accessing good jobs with fair pay, the health of people and the health of communities can suffer. And what we are seeing now is people responding to injustices in these areas and other areas that have spanned generations. This is certainly a very complicated moment with both COVID-19 and racial justice issues being front and center simultaneously. But we had the opportunity from a public health perspective to stand with the peaceful protesters, helping to make sure that they were safe from a COVID-19 standpoint. The majority of people that we saw were wearing masks, and we made sure that they had information available to them, as well as the testing that's available to them. And we also supported what protesters were saying, in that all people and all families deserve to be safe and healthy, and that Black Lives Matter. From a public health perspective, it's imperative that people continue to be engaged. That means being involved in your community, that means voting, and that means standing up and calling out injustice when you see it. As we've been saying over the last week, we all have farther to go. That includes people like me in leadership positions. The way forward from here is making sure that we listen to people in communities that are disproportionately impacted, making sure that we listen to each other, and then coming together and acting as one community and one state, doing what we need to keep each other safe as well.